The American Cancer Society estimates that more than 230,000 new cases of invasive breast cancer will be diagnosed just this year. Well, actress Angelina Jolie's decision to undergo a double mastectomy has really put the spotlight on preventative procedures and different measures that you can take to prevent it. And joining us this morning from the UNM Cancer Research and Treatment Center, our senior genetic counselor, Ballinger. Hi, Lori. Thank you for being here.
Thank you.
And also pleased to say surgical oncologist Dr. Katherine joins us as well. Thank you both so much for being here to talk about this very relevant topic. I mean, Angelina said that she made the decision to have her double mastectomy after she learned that she had a faulty gene. That's what we're hearing about, and that gene increased basically her risk of developing breast cancer. So can you explain what that gene is and how it increases your chances?
Sure. The gene that Angelina Jolie has is called BRCA, and there are two BRCA genes. She has BRCA1. Women who have a BRCA1 gene mutation have a very different risk of breast cancer than women in the general population. Women in the general population have about a 1 in 8 risk of breast cancer, so no one is really at low risk for breast cancer. But women who have mutations in these genes have a lifetime risk of breast cancer of 50 to 85%.
So how is the gene detected? I mean, how would somebody know? How should they be tested? How does that work?
Great question.
Well, one of the things is that paying attention to family history, because only a very small proportion of breast cancers are strongly inherited. Most women with breast cancer do not have a strong family history.
Got it.
If you have a strong family history, that is when you would consider having genetic counseling and possibly genetic testing.
Which we know Angelina's mother had that, so we know that that's what maybe triggered it for her.
Exactly.
But could you explain the difference between basically getting a preventative mastectomy versus a partial or radical mastectomy? What is the difference?
Oh, it's a great question. So we actually don't call them preventive mastectomies because it's not 100%. It's a risk-reducing mastectomy. So she has cut her chance of breast cancer by about 90%, which is amazing, but it's not 100%. So first thing to consider for any woman who is facing this type of decision is to really understand that they're reducing their risk, not cutting it to zero.
There's no guarantee.
I wish there was.
We sure do wish there was. Well, we also know that Angelina's procedure took 3 months, and that's from start to finish, the whole entire process. So what exactly is involved for somebody else who's thinking about doing this?
It's the first step is to have the mastectomy, which is removing all of the breast tissue, in most cases including the nipples. Some people choose to have a nipple-sparing mastectomy, but that leaves a little bit more breast cells behind. We don't know if it reduces your risk as much. So the first step is the mastectomy, and then generally in that surgery at the same time a plastic surgeon will come in, and after the mastectomy they'll put in what's called expanders. And those stretch the tissue up after we've removed some of the skin, not all of it, we spare most of it. Stretches the tissue up so that then a few weeks, months, depending on how big the woman wants to choose for her implants. That's when they go back and they take the expander out in a day surgery and put the implant in.
So this eliminates that fear for women that they will start to feel, self-conscious of their bodies.
They don't wake up completely flat, and I think that's a really big benefit.
It is important. It's so much from the mental perspective of this. And so do you believe that this is going to set a precedence for so many other women?
Well, we actually, because she's a celebrity, this has come out, but we have lots and lots of patients in our practice.
I'm sure.
Who have done this.
I'm sure you have.
So it is a very brave decision that she makes, but it's a decision that lots of other folks have made. And I think that there is the information that this is one possibility for reducing risk. There are other things that women can do that are not mastectomies when they're at high risk as well.
And so I know you can guide them through this. And speaking of guiding people, I know after a procedure like this, there is, like I said, a lot going on mentally. Do you have counseling services for the women?
It's a really important part of our cancer center and program.
Before and after?
Before and after, and I think it's critical to make sure that women get all of the information from the surgeon, from a clinical psychologist, from the genetic counselor, the plastic surgeon, so they really have all the information that they can get going in and then have the support afterwards.
Exactly, because you need it before and after, you really do. And so I think it's very brave, and obviously Angelina is a celebrity, so she brought it to the public eye, but it's brave for all the women out there who do this, and so many who are considering it right now will want to be able to follow up with you. How can they do that and get more information?
Well, one of the things is they should talk to their doctors to really see if they are at high risk.
Okay.
Because not everyone, even who has a family member with breast cancer, is a high-risk person.
Good point, okay.
So they should talk to their doctor about whether or not they might be high risk.
Okay.
We encourage that all patients have genetic counseling before they have genetic testing. That's really standard of care.
Okay.
It's something I feel really strongly about.
too.
I think you shouldn't just go get the test.
Right.
You really need to have someone with Lori's skills and knowledge to talk you through the process, because it is a big deal and you cannot
Sure is.
unring that bell.
Very good, very, very good point. And a lot of people need to know that. How can they be in touch with you?
They can be referred by their physicians.
Okay.
So they can go through their physicians. I think they can look at our website.
Okay.
I think
well.
you guys will put up the logo for
Yes,
the
right
UNM
here,
website.
of course.
That's great.
You can go to cancer.unm.edu. And I thank you both so much for shedding even more light on a very, very important and possibly life-saving topic. So thank you both again so much for being here.
Thank
you.
Appreciate it.